Welcome to What I'm Reading, What I'm Thinking, a behind-the-scenes look at the research shaping my upcoming book. I'm Isaac Osborne, and today we're diving into one of the most misunderstood aspects of human physiology, subconscious breathing patterns. This episode explores a question I've been working on for years. How do we actually change the breathing patterns that run automatically beneath our awareness thousands of times every day? You breathe 20 to 25,000 times a day. Most of those breaths happen without your awareness, and that's both a feature and a problem. The body learns to breathe automatically based on the environment you live in, the stress you carry, and even the posture you hold. If your body learns a shallow, restricted, or stress-driven pattern, that becomes your new normal, your subconscious breathing pattern. And here's what makes this so challenging. These patterns don't just affect your lungs, they shape your structure, your nervous system, and your ability to adapt to stress. At the center of it all is the brainstem, specifically the medulla and the pons. These regions generate a rhythmic signal that drives every breath you take automatically. It's like a built-in metronome called a central pattern generator, or CPG. This system doesn't just fire blindly. It adapts constantly based on what your body tells it. Pressure changes, CO2 levels, stretch in your lungs, and even tension in your fascia. The brainstem integrates all these signals through chemoreceptors and mechanoreceptors, sensors that monitor the chemical and mechanical state of your body. The problem? Under chronic stress, pain, and postural tension, those signals change. And so does your breathing rhythm. When stress becomes constant, the nervous system rewires itself. It learns a protective breathing pattern, fast, shallow, neck dominant, whatever the body needs to feel safe. That pattern becomes encoded in the brainstem through feedback loops between your body and brain. You don't have to think about it anymore. Your body just does it. This is what I mean by a subconscious breath pattern. It's the autopilot setting your nervous system defaults to, shaped by months or years of adaptation to stress, injury, or dysfunction. Most breath training focuses on conscious control. Inhale through the nose, expand your ribs, slow it down. And yes, that feels good temporarily, but here's the catch. You're using the motor cortex, not the autonomic centers that actually run your breathing when you're not thinking about it. So as soon as you stop focusing, the body returns to its old default. You can't overwrite a subconscious pattern through conscious effort alone. It's like trying to debug software by typing harder on the keyboard. To change the automatic system, you have to speak the language of the automatic system. That means changing the sensory inputs that feed it: interoception, pressure, fascia, movement, and nervous system state. Research by Sloboda and Roberts between 2017 and 2021 showed that fluid pressure within muscle tissue directly influences mechanical behavior and force transmission. When the diaphragm moves differently, particularly with subtle low-load oscillations, it changes the pressure environment inside your body. That sends new information to the mechanoreceptors and baroreceptors in your thoracic cavity. This resets the body's understanding of what normal breathing actually feels like, and the brainstem begins to adapt. Sakiris and colleagues demonstrated in 2011 that interoceptive awareness, the perception of internal bodily signals, is fundamental to how we experience our bodies and regulate our state. When you change interoceptive feedback, you change the body's internal map. The breathing exercise I developed works exactly on this level. It uses minimal conscious control, so you're not trying to breathe right. Instead, the exercise creates a gentle oscillation of pressure inside the abdominal cavity. That movement feeds the brainstem new data through baroreceptors and mechanoreceptors, sensors that detect pressure and stretch. In other words, it retrains the system from the bottom up. Clients often feel their spine decompress, their neck tension melt, and their whole nervous system calm down. It's not magic, it's physiology recalibrating itself. The body is learning a new default pattern at the subconscious level. If you're interested in learning this assessment and repatterning approach yourself, whether you're a movement professional, bodyworker, or clinician, I'm teaching a live workshop this February 2026 in Santa Barbara, California. It's called Breath as Structure, and it's designed specifically for practitioners who want to integrate breath assessment and correction into their work with clients. In this 2-day intensive, I'll teach you how to assess dysfunctional and subconscious breathing patterns, not just what you can see, but what's actually happening beneath the surface. The specific exercise I've been describing today that changes subconscious breath patterns, along with several other structure-based corrective exercises. Assessment techniques that reveal how breathing compensations affect posture, mobility, and pain patterns. How to apply these strategies without relying on hands-on tissue work. How to integrate all of this into movement training and clinical sessions in a way that's immediately practical. This isn't a theoretical workshop. It's assessment-driven and application-focused. You'll leave with tools you can use with clients the following week. The workshop runs February 28th through March 1st, 2026, here in Santa Barbara. All the details and registration are in the show notes. Now back to the science. This brings us to fascia, the connective tissue network that wraps every muscle, organ, and structure in your body. Research by Finley and Schleip, published in 2013, shows that fascia is intimately involved with respiration. It's not just passive wrapping. It transmits mechanical forces, responds to pressure changes, and communicates with the nervous system. When subconscious breathing shifts, fascia responds. The tension patterns change, fluid dynamics shift, and the whole fascial network begins to reorganize. This is why clients report changes beyond just breathing better. They feel straighter, lighter, more grounded. The structure itself is responding to the change in pressure and rhythm. When subconscious breathing resets, you see structural change because pressure is a foundational organizing force in the body. Diaphragm mechanics normalize. The dome moves fully. Tension balances across its fibers. Intra-abdominal pressure balances, creating even distribution through the thoracopelvic cylinder. Spinal stabilization improves. The spine finds its natural support without muscular effort. Fascial hydration and mobility increase. Tissues become more adaptable, less rigid. Autonomic tone rebalances. More parasympathetic dominance, lower resting tension. This connects neurophysiology with biomechanics in a way that few interventions can match. Rosalba Courtney's research over the past 2 decades has shown that dysfunctional breathing patterns profoundly affect autonomic nervous system function. When breathing is dysregulated, the autonomic nervous system becomes dysregulated. Heart rate variability decreases, sympathetic tone stays elevated, the body lives in a chronic state of activation. Stephen Porges' polyvagal theory, developed in the 1990s, gave us a framework for understanding how vagal tone, the influence of the vagus nerve on heart rate and breathing, mediates our sense of safety and social engagement. When you normalize subconscious breathing, you're not just moving air differently, you're changing the signals that tell the brainstem whether the body is safe or under threat. You're shifting autonomic state from the inside out. The research backs this up across multiple domains, from Porges' work on vagal tone and the polyvagal perspective on autonomic regulation, to Sloboda and Roberts' findings on how fluid pressure influences muscle mechanics and force transmission, to Sakiris' research showing that interoceptive signals fundamentally shape how we perceive and inhabit our bodies, to Finley and Schleip's documentation of fascia's role in respiration and structural organization, to Courtney's comprehensive model of dysfunctional breathing and its effects on posture, autonomic function, and regulation. All of these lines of research point to one truth: breath isn't just air. It's pressure, sensation, structure, and communication between body and brain. Change the subconscious pattern and you change everything downstream. That's it for today's dive into the research. If you're enjoying this process and want to see how all these ideas come together, make sure to subscribe and stay tuned for the next episode. There's a lot more coming. And again, if you're a practitioner who wants to learn these assessment and repatterning techniques hands-on, join me in Santa Barbara this February 2026 for the Breath as Structure workshop. Details are in the show notes. Thanks so much. Until next time, remember, you can't consciously fix a subconscious problem, but you can retrain it.